So a lot of times they'll come in, or patients will come in with low back pain that's located on one side, and when you watch them walk, that side of the pelvis is a little bit elevated. When you go and check them for SI joint, you find that that side is hypomobile, and even the lumbar spine will be hypomobile on that side in the facet joints. One really easy clearing technique that works a lot, especially with people that are quite painful. You're unable to do any lumbar manipulation, but this technique seems to be okay because it's more of an axial traction thrust. So what you do is you evaluate by just taking the leg and just giving an axial pull up through the leg into the pelvis, even into the lumbar spine. You're checking fascia, you're thinking fascia, you're checking also just joint mobility, SI joint, lumbar spine. You go to the other side, you do a comparison. And whatever side feels like it's not dropping, that's the side you're going to target. Okay, so Mark, and when I was checking Mark here, what I did is I asked him what side felt tighter, because I knew the right side was tighter, but I wanted him to verbalize it, and he verbalized it. So I know I'm pretty much on target here for what I'm treating. So what I'm going to do is do a little internal rotation to lock the hip joint, to close pack that joint, so we're not going to get too much gapping. And I'm going to pull right into it, and I'm going to ask Mark, is that hurting you, Mark? Do you have any problems with that? No, okay. So I'll take out the slack, and then the technique involves me taking my hands and pulling them right into the side of my body. So it's just a boom, like that, okay? So Mark, go ahead and lay your head down, and it's just gonna be a tug like this, and like, just like that. And for whatever reason, if that didn't seem to clear it, you could change it into a muscle energy technique, which looks like this. It's the same setup, except you pull until you feel the tightness and the resistance from the area that's not allowing you to pull, and then you have him take his right hip and pull it up towards his head. You try to not have him do that. You try to maintain the pull down so he can't move. Now push down, Mark. Then you take up the slack. So he pulls up, and then he pushes down, trying not to allow him to pull up that much, so you resist that. Pull up, and now push down. And cut.